promised to make a video about MirrorBox and how we use it and why we use it. And with no further delay, this is MirrorBox. You know me, Dr. Ramin Safakish. First, I would like to apologize for the quality of my voice. I recently was in hospital with COVID, and unfortunately, it had affected the quality of my voice. I hope you understand what we are talking about today. I never kept it a secret that I suffer from CRPS, Complex Regional Pain Syndrome. It is not something that usually doctors tell their patients, but overall, I would be one of the most experienced authority in that area because the extensive work I have done. My condition started from the left foot after surgery in 2007. Gradually, the other foot had been involved, but you can see the difference between 2 feet in these photos. As you see, the left foot was swollen and more red than the right foot, and the changes of the skin started to be apparent after a few years. This is another view that you can compare 2 feet together. But since the life is not fair, very soon another limb had been involved, my right hand. In this view, I put the feet and the right hand together that you can compare the shape of these two and appreciate the acuteness and chronicness of each condition. This is another view of the right hand. I would like you to pay attention to the swelling of the fingers that affected the shape of the fingers. What I mean is the creases are started to flat out. Now another view of the back of the hand, and now again you see that the creases are gone because of the swelling of the fingers. The view has changed, and in this view I would like you to pay attention to the mirror shape of my right hand. Here is a mirror. You can see part of my right hand in it. Why MirrorBox works, that's a talk for another day. But unfortunately, when I look into the literature, there is not much available about how to use a MirrorBox. So I had to learn from scratch. In this view, what you see is the mirror picture of my left hand, the good hand, that substitute in the mirror as my right hand. Now I put both hands beside the MirrorBox that you can see this doesn't work because I cannot trick my brain to understand that looking at the right hand and left hand in the mirror could be simulated the reality. Here you see the changes and the differences between the right hand and left hand even though the MirrorBox is in use. There's several error and try. This is how you can do. You have to bring the hands together the way that you can trick your brain that your brain sees the right hand separately and the left hand, even though what you see is a mirror shape of the left hand. So the good hand that does not have cause any pain sees in the mirror as the right side, and then the physiotherapy starts. You're going to move both hands at the same time while your brain sees a good hand only. So the brain understands that the stiffness might have been a mistake because what it sees in the mirror tells your brain that there is no stiffness.